Hello and welcome. We're so glad you're tuning into the Taking Good Care show. I'm Dr. Andrew Wong, based in Toronto, Canada.
And I'm Dr. David St. Arno, based in Edmonton, Canada. We're two practicing psychologists with over a decade of experience each, working in a variety of settings and supporting diverse populations.
Thanks for joining us. We hope you enjoyed today's episode. While we're both practicing psychologists, our podcast is intended purely for educational and entertainment purposes. It's not a substitute for professional mental health care or treatment. If you're in need of support, we strongly encourage you to reach out to a licensed mental health professional in your area.
Hey, Andrew.
Hello, Dave. How's it going?
Life is pretty good right now. We had a big game last night, so this might date us for when we're recording this, but the Oilers just moved on to the second round. So I think Toronto did okay too last night.
Toronto moved on as well. Although, to be very honest, I probably follow the Oilers closer. And people may not like me for saying that, given that I live in Toronto, and I probably follow the Habs more too than Toronto. But
oh no, the hate
that's
mail.
even worse.
The hate mail that's going to be coming your way.
That's right. That's right. Otherwise, it's been a busy week and just lots of stuff going on. So speaking of which, when it comes to a lot of stuff and, the brain is chugging along, working away, our episode today is going to focus on attention deficit hyperactivity disorder, ADHD. You know what? I think it's one of those topics where many people are curious about it. It's been around for a long time in terms of this label, diagnosis, and we could probably honestly do like 3 episodes, if not more, on just ADHD. But we'll start with this one and we'll see where it goes.
Yeah, I've been excited about this episode. I think there's a lot of misinformation, like is ADHD even a thing? Or is it just like everyone has ADHD? And so you hear so many comments about ADHD. And even one of the books that my kids are reading right now, the Dog Man book, there is it's literally, they call it 80, like the number 80 and then HD.
Yes.
And so it's in a lot of popular kind of media right now, and
Yes.
it's been around, like you said, for a long time. But I also think that there's a lot of misinformation, and we're not going to clarify everything today, but hopefully we'll hit some of the highlights. And for the listeners, those that have been questioning it or wanted to know more about ADHD, that this will at least get you started and point you in the right direction to learn more about it.
Yes. Speaking of Dog Man, I thought that was very clever the first time I ever read that book. I never explained it to my son. That's just too much. It's like nighttime reading. I'm too tired.
Well, I was at a restaurant this weekend, and restaurants are not great for kids with ADHD. And so my youngest, that is not diagnosed, but it came up, and he's like, "I'm ADHD," and he's referring to the character in Dogman, and he's jumping over the chair in the restaurant saying, "I'm ADHD," and I'm looking around like, "Oh my goodness, like what are the other people thinking right now in this restaurant?"
You're trying to convince the other people in this restaurant.
I'm like, oh geez. But I think, picking up on that a little bit, a little self-disclosure, my oldest son is diagnosed with ADHD, went through a full psychoeducational assessment. So not only does this have like a professional importance to me, it also has a personal importance. And I myself am not diagnosed with ADHD. I don't think I have ADHD. Sometimes, my wife might have different views on that, but I don't believe that I, personally experienced the disorder. So learning about it and wanting to support my son and in school, at home, it really ramped up my deep dive into this topic, because I do want to help people that come through my office, but I also want to help my little guy at home.
So that's interesting, right? Is going through that deep dive. I think for me, the deep dive was more so working with so many children and families, navigate the school system. How do we get the help for your child? And at home too. I mean, ADHD presents itself at home too, and that can be a big challenge. And so helping families and caregivers through that journey too. Funny enough that you brought up that you don't think you have ADHD, and I'm not going to say that you do or don't. I was just going to say, I think in learning about ADHD all these years now, I wouldn't be surprised if I actually do have ADHD,
Hmm.
but like since I was a kid, but probably not the hyperactive type.
Yeah.
That might have been taken out of me by my parents. But in terms of the inattentive type, for sure, like, the number of times I remember my parents saying, how come it seems like it's in one ear, out the other? Like, did you not hear me? I just told you that an hour ago. How did you forget? And then even as a teenager, going through things that I was really interested, I could get really focused on and do really well at it, but stuff that I just did not care about, man, like it was such a hassle to have to do it. And in terms of like the extracurriculars, when I was really into it, like I'll go full on and like create programs. I don't know if you remember in Edmonton when I did that sort of weekend workshop convention, like just full on contacted people for donations, and like it was just hyper focused. Even to this day, just the brain's just constantly thinking, oh, what's new, what's great. And it doesn't seem to stop. I'm coming to the acceptance, and I told my wife Amelia the other day, I don't know if I can't stop, and even if I wanted to, could I? Like it's constantly just going.
Yeah.
And yeah, so I don't know.
Well, and I appreciate you sharing that. I think a lot of listeners might be in the same boat. And I know that I've seen a lot of adults in my practice that because I've, been more sensitive to it, I think, by learning more about it,
Yeah.
that it's like, oh my goodness, there are so many adults that have struggled a lot in their life
Yeah.
and they didn't have a way to explain it, right? And for so many adults, like the low self-esteem that comes with this, right? Because they've
Hmm.
they've let people down or they've missed deadlines or they're, late for things and people label them as lazy or as like not caring and oh my so if you're out there and you're listening to this, like there are many, many adults that did not have a name for what was challenging for them. And hopefully, even in your description, there's a bunch of key elements that I think like ADHD, the name itself is misleading, right? It's not just attention and hyperactivity. There's more
Yeah.
to it. So,
I don't even like the fact that disorder is in there, right?
yeah.
Because I think for many people, who are adults now, once they find their direction, they can be very, very productive individuals in their field. So is that disordered? I don't think so.
Well, like there's mixed, it's mixed because there are people writing about it as like a gift, right? Like
Yes.
ADHD as a
Yes.
gift, right? But one of the lead researchers that I follow, he's pretty clear, Russell Barkley, he's like it potentially could be a gift in certain circumstances, but in our current society, right? Oftentimes it creates a lot of challenges. And so one of the things that I love about the research is that there is no connection between intelligence and ADHD, right? So you can be super bright and really successful and highly like I know a lot of, university professors, other
Yeah.
psychologists, other professionals that, are diagnosed with ADHD and have achieved great things. And so I'd put you in that category, right? Like, but no doubt you have found strategies, right, to
Yes.
to compensate or to adjust for the challenges that you experience. And I think that is a lot of the hope that you can have, right? That it doesn't have to be what we call like a handicap. It can be a disability that has accommodations for it. And
Yeah.
then you can be quite successful and happy and live a great life.
And I think that is through a lot of support. So that's not to say I haven't had a lot of support throughout. I have, don't get me wrong. So I think that's really important for children, the kids and the teenagers who I work with. It is really tough. And I've seen it happen in the schools. I've seen it happen in my office. When I worked at the school board, you have children jumping out, a ground floor window because they don't want to be there, bolting from the school. And so, yes, it can be very, very challenging. So, it's not to say or dismiss that, it's sort of like you said, this gift, that some people will frame it. For others, it is very challenging. And it's through a ton of support through the schools, through caregivers, that I think as children become teenagers, then some of them will find their way and use the behaviors and symptoms of ADHD to really propel them forward. And unfortunately, it's not everybody who gets there either. right? So I think it's important to acknowledge that, as even with some adults, yeah, you will continue to struggle. So attention deficit hyperactivity disorder, what does that entail? There are three different types, right? So if you go through a formal assessment with your children or teenagers, typically a psychologist or perhaps a pediatrician will run some questionnaires with the caregivers, with teachers to see how your child is functioning at home and at school, if they are meeting some hallmark indicators of attention deficit hyperactivity, and then conduct a thorough interview with the caregivers, observe the child, whether it's in the office or in the schoolyard or in the classroom. Oftentimes, this is also paired up with what we call a psychoeducational assessment, where they look into the students' learning abilities, their logical reasoning abilities. And again, we could go into another episode about psychoeducational assessments. But we won't go there today. But just to know that there are formal testing methods that we use, and they have to hit certain indicators and symptoms to suggest that there is a diagnosis. And then from there, you can be diagnosed with three different types. So there's the inattentive type. So, just anecdotally, these are kids who will, let's say, sit in the classroom. They might zone out a lot, daydream a lot, and these are the kids who won't pose too much of a challenge in the classroom. And I sort of see these kids as the ones who will sort of fall through the cracks a bit because they may be quieter in class, but the teacher doesn't recognize that they're not really paying attention for the last 10 minutes, 15 minutes, right? So they miss a whole chunk of the lesson. Then you have those who are the hyperactive type. So these are kids, again, if I use a classroom example, they may need their movement breaks. It's hard for them to sit in their seat for long periods of time. They may fidget with stuff, but it doesn't mean they're not listening because I've had many teachers say, well, yeah, if I ask him or her a question, they can still answer the question accurately. They're just not looking at me or it doesn't seem like they're paying attention, right? Or kids who may be pretty impulsive as well. So they may in the moment, in the heat of the moment, they might get angry and they lose that sort of self-regulation. Like I said before, they may bolt from the school, they may hit someone else because they're just so angry in that moment. And then you've got the combined presentation, right? You've got the inattentive and hyperactive impulsive type. So they're presenting with both kinds, right? So they're hitting the indicators for both. So you've got the three types. And for me, the biggest piece as a clinician is understanding how much it's impacting the individual, whether it's in the classroom, at home, at work, and how debilitating it is.
Absolutely. And I think, geez, I want to pick up on a bunch of points that you just made, but even just, yeah, going back even to what you were saying about hyper focus, I think that's it's a very misleading aspect of of ADHD, right? Someone will say, well, they don't have ADHD, they can focus. Look at how long they can play a video game. And it's like, yes, they are able to hyper focus on things and really focus and like not attend to anything else around them
Yeah.
if a certain level of stimulation is there. And so video games are highly stimulating, and anything that is highly interesting, highly stimulating can capture that ability of a child who struggles with attention.
Highly motivating too. The thing about
Hmm.
video games, I mean, video game creators they're clever, right? They're clever. They know how to capture their audience. So when you think about the child with ADHD and especially the hyperactive impulsive type, they are often going towards things that they gravitate to and they find motivating. So with video games, oh, you know what? You pass a level, reward up, you get this much more tokens or whatever. So you're constantly being reinforced to keep playing because you're being told, you know what? This is so awesome. I'm getting this, I'm getting that. That dopamine hit is just coming minute after minute, right? I made a kill. Oh, this is great. I level up. I get this new weapon. Constantly that.
Absolutely. It's instant gratification, right? It's immediate feedback. And so working with any kids that struggle with, that have been diagnosed with ADHD or struggle, like that is a strategy that is going to be helpful. As much as you can reinforce things right away, you are going to get better cooperation, you're going to get better behavior. So these kids are going to struggle with the
Yep.
delayed gratification, right? So do this and you'll get the reward at the end of the week is just not going to have the same traction as it would for a kid without ADHD, right?
Oh, Dave, you have no idea how many consultations I do with schools and
Yeah.
teachers and principals. And when I hear about programs and reinforcement schedules, I'm all for them. And people will ask me, isn't that just bribery? And I always say, as one of my old supervisors said, you know what, it's semantics. Call it what you will. If it works, it works. You know, I'm totally fine with providing rewards and reinforcers, but with the student with ADHD, they can't wait for an hour to be reinforced. So if you're like, I can create a program for the child at school where it says, okay, let's define three things that we need to see, right? So let's do every hour, let's complete three questions on a worksheet. Or, if you need to go for a movement break, like let's raise your hand and ask, and you'll definitely get a movement break, right? But we need to ask. We can't just bolt from the classroom. So let's define those behaviors and then we'll reinforce them every time they do that behavior with like a sticker or a check mark, and then perhaps they get some sort of larger reward by lunchtime. The problem is when the teacher tells me, oh yeah, I reinforced them, and I ask when. And they're like, oh, I couldn't do it right away. I did it like 30 minutes later. That child cannot wait for 30 minutes to get that sticker to show that you noticed and that they did something really positive.
Which is frustrating for teachers and other adults and parents, right? It can be really frustrating because, it involves a lot of extra support, like you were saying. And so, even thinking of my little guy at home, one of the important strategies. So maybe I'll mention these books right now, but Russell Barkley has written like 12 principles for raising a child with ADHD, which is a really kind of short form of the longer book that is taking charge of ADHD. And there's also taking charge of adult ADHD. So these are great resources that are going to kind of highlight a lot of the areas that and go into more depth of what we're talking about. But one of his strategies is touch more, talk less, right? So actually walking up to the child, making physical contact, because what that
Yes.
does is it means you are in their sphere, right? And hopefully you're making eye contact with them because they are going to attend to what's right in front of them, right? And so if you're touching them and you're contacting them and then they can look at you and then you say, "Hey, I'm going to ask you or I need you to go get dressed," right? You don't want to be screaming this from across the house and go, "Hey, time to get dressed." And then 10 minutes later, "Hey, time to get dressed." And then 10 minutes later, it's just not going to work, right? And
Yes.
understanding that this is a neurodevelopmental disorder or delay for kids. Like, so.
Yeah, I think that word neurodevelopmental is important to touch on as well. This is not something that was acquired, due to poor parenting. I want to make that very clear. The fact that it's neurodevelopmental means that the child was born with this, right? This is the way the brain is hardwired, right? For better or for worse. And so we have to find strategies that work. So to your point, many kids with ADHD, let's say they are getting in trouble at home and at school. Trust me, these kids have been lectured over and over again, right? Eventually, these lectures have no effect whatsoever. In fact, you will get the eye roll. You will get the this again,
Mm,
right? And they just zone out from these lectures. That becomes a defense mechanism for that, right? They don't want to be lectured. Nobody goes to school, as I always say. They don't go to school thinking, "Oh, yes, I'm gonna create havoc today, and my goal is to get in trouble." Nobody goes to school thinking that, right? So, when something does happen, I think to your point, like touch more, it's like let's break that neural circuit that their expectation is, oh man, I'm just gonna get lectured again. So and so is just gonna talk to me for another 20 minutes about the same thing that they talked to me about yesterday. So, sometimes it's like giving a tap on the shoulder, like I notice you, right? Let's turn it around. You're losing your focus here, right? So I tap, even tapping the table, like
mhm.
I see you,
Yeah.
I notice you. I'm not gonna say anything, but know that I'm here and I'm trying to redirect your attention.
Absolutely, that relationship piece, right? And I think if parents and teachers are frustrated and they think lecturing or punishing a child to get them to change their behavior, again, this is really important that it's neurodevelopmental. Russell Barkley's got this like kind of a ballpark, if you want to guess where your kid is at in terms of these executive functions that I hope we have time to talk about, it's about 70 or about 30% lagging behind other kids, those that are diagnosed with ADHD. So if I take my 8-year-old boy and I calculate that, that puts him at like a 5.6 age for these executive functions, for these skills that the kids eventually do learn. We all have these skills to some degree, but they're going to be far behind. So when I look at my 8-year-old, or if the teacher looks at him like a grade two, right? Like then and treats him like that, that is actually going to be really frustrating on both ends, right?
Yep.
Because it's not something that he's able to change, right? But it's invisible. Like we can't see it. The kid looks typical, or the adult looks like this is a successful CEO, right? And they're
Yeah.
just disorganized.
Yes.
Well,
I think what you said is important, David. Like, they don't quite have the skills yet, right? So the mismatch of expectations,
mhm.
where the adult is going, well, you're 8 years old, you should be able to do this. And you've got the 8-year-old sitting there going, I don't know how to do this because I haven't developed those skills yet. And so it just becomes this conflicting expectation of what the child can or cannot do, or also the conflicting expectation of what the adult, should be doing and how to support that child.
Yeah, and I think when we're working with parents, making sure those expectations are consistent with the child's abilities. And so sometimes, like these evaluations, these assessments can
Yep.
really help with that because parents are like, no, 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 no. When I was that age, I was, getting myself dressed, I was making my own breakfast, and I was walking to school. It's
Yep.
like, yes, you were, right? But this child right now, and it's not a lack of, they're just looking for attention, or they're
Yep.
just, again, I want to go back to this neurodevelopmental and this delay, and it's not consistent, right? So they could be really bright and intelligent, or really able to do certain things that their peers can do at that age, even like athletically, right? But when we look at these specific skills of executive function, then we can get a better idea of like, oh, well, this makes sense. This is why
Yeah.
this is hard for this child or this adult, right?
Yeah. I have a very, I think, a very pertinent example here, of the ADHD child where I know, and this can be for another episode, we talk about, this idea of gentle parenting. And don't get me on that soapbox, that'll be another day for that. But for a lot of the children with ADHD, even without ADHD, I think it's so important to have that sort of firm parenting and understanding your child. Like if there's somebody who does struggle with attention and, like you said, executive functioning, this ability to self-control and self-regulate and self-manage. I had a family once that, they say, well, I want my child to make their own decisions at 6 years old, in the mornings, right? That should be a skill that they should develop. Sure, you know what? I think in the ideal world, yes. But when the child presents with some of these symptoms and you want them to pick out their breakfast out of 10 types of cereals, right? They're going to be flustered. They're going to be saying, I can't manage this, right? You're asking me to pick 10. Well, I like all 10. And so, the child is sitting there for 10 minutes and they haven't eaten. And then now the parents are screaming at them to get eating and out of the house. Those types of examples, it's like, why don't we just reduce it down to two? Right? Or better yet, if needed, just let them know what they're going to eat that morning, right? They're not quite at that developmental stage. Again, neurodevelopmentally, they're not at the stage where they can make those decisions. As easy it is for us as adults to say, yeah, just pick one. To them, it's like too much to think about first thing
Hmm.
in the morning.
Well, even as adults, a lot of adults diagnosed with ADHD, it's like it's difficult to prioritize. Everything feels important, and you might start five different things because they all feel important, and it's hard to make those decisions. So the more you can simplify it, right, it's gonna be better for you. And again, with this like neurodevelopmental stuff, there's a highly genetic component to ADHD, right? And they roughly ballpark it at like 70% is genetic and 30% is other factors. And so we
Yep.
know, like you said, it's not related to parenting. It's not related to diet. It's not like those things could influence it to some
Yes.
degree, but really understanding that this is likely not going to change. And that's why part of the diagnosis for it is that it's across different environments, right? this isn't just something at school. This isn't just something at home. This is, these skills are there all the time. And if they're lagging, they're going to be lagging consistently, right?
Yep.
So with the genetic component for the listeners out there, right? For a child that's diagnosed with ADHD, it becomes very likely that one of the parents has ADHD, right?
Probably.
And so yeah, well, that's what some of the research shows. So you start looking at that, and I've had adult clients that, okay, now they've been diagnosed with ADHD, and they're like, oh my goodness, like I need to talk to my dad, or I need to talk to my mom, right? Like, because now the light bulbs are going off that, like, we thought these were just quirks. We thought they were just like, but they're, this could go kind of across the generations, and knowing that, right, is really helpful, because then you can start to go like, this makes sense. And now we can do something.
And I think knowing that is helpful too, because then we can provide proper interventions and treatment. Because one of the things with ADHD, and again, it's been such a well-researched area, we know that as children grow up to teenage years to adulthood, if it's not managed well, other concurrent disorders can arise. We know that children with ADHD, again, if it's not managed well, they'll develop anxiety, right? Depression, other types of mental health issues as well. And it's more prevalent for this population. Right. And whether or not, again, that's neurodevelopmental, or perhaps it's because, sometimes for kids in the classroom, they know that they're struggling. It's not managed well. They're falling behind in school. And so their self-esteem, self-worth just plummets. And so now the teacher is saying, well, okay, math test, but you missed half of the material. You get anxious, right? The anxiety starts
Mhm.
to increase. Your sense of self-worth and self-esteem plummets, and a low mood or depression sets in, right? So all these sort of ripple effects can happen if not managed well.
Absolutely. And again, like if you are getting called out, if you're in front of the class, right, and the teacher is calling you out, or your parents are calling you out, and they think this is going to help motivate you, right? But really it's something outside of your control. What's going to happen?
Yeah.
You're going to you might even not want to go to school anymore. Have so much anxiety that the teacher is going to, do something that's going to embarrass you, or yeah, oftentimes it's not just ADHD, but understanding ADHD can also help understand other stuff. And again, with adults, the light bulbs go off, and it's like, oh, I understand this
Yeah.
now, and now I can do something about it.
Yeah.
Right. And so, people are like, well, everyone's ADHD, and there's this overdiagnosed, and let's go back to the research, and it says, 5 to 8% of kids
Yeah.
in different countries, different cultures, like this is across the world, would be meet the criteria as it
Yeah.
is right now with the DSM for ADHD.
Yeah. So that's why there's such a rigorous process in diagnosing ADHD, right? And to be very transparent, I get a number of calls from family doctors who are very hesitant to diagnose children and adults. And they'll say, can you do it? Right? Because we do have rigorous methods of doing it to rule in or rule out ADHD. And even with some of our adults, and we were talking a little bit about this before recording, with the adults who we see at our clinics, a lot of the time they're coming with something else, not just ADHD.
Yeah,
Right. So whether it's anxiety, past trauma, depression symptoms, there's so much to tease apart in terms of those assessments. And just know that also depression and anxiety symptoms and trauma symptoms can also mimic ADHD. So is it standalone ADHD? Is it other clinical disorders? Or is it both together? So that ruling and ruling out of different things is so important.
absolutely. And I think, oh, I'm cautious how I frame this, but maybe I'll use the personal example again. Is my son, we suspected, and with my training and education, I probably, I knew what the results were likely going to be from the psychoed assessment, but we took him to the pediatrician, and
Mm.
the pediatrician saw him in the waiting room, and it was like, he's got ADHD. Right. So, like I like that family doctors or pediatricians are calling you and referring people to you so that you can do a proper assessment, right? And rule out other causes that present like ADHD. Ideally, that is the way things go, but I understand that a lot of this is private. And if you can't afford it, right? Or if you're on a wait list at the school and it's 2 years, I do refer people to talk to their family doctor, to their pediatrician, because maybe that's the only way that they might be able to get an assessment and possibly some medication that might be able to help.
Or ask your family doctor to refer you to somebody who has that expertise, a colleague who has that expertise. Even if they don't, it doesn't mean that all family doctors can't or that, only psychiatrists can. No, there are family doctors who are very competent at diagnosing ADHD.
Yeah, and I think, again, within the context here in Alberta, to try to find a family doctor right now is really hard. So you might not be able to get a referral to another family doctor with specialization. So hopefully, again, we want you to have enough information to do the right thing for yourself and your children, right? Know that ADHD is not an easy thing to diagnose. And if your TikTok feed is feeding you videos of ADHD and you kind of suspect it, and like I hopefully you can get more of a professional evaluation before you get a label.
And I think that proper diagnosis is so important because then leads into a discussion about treatment, right? And I think this is a debate always about treatment. A lot of people will think about, okay, medication or no medication, right? And, whenever we're putting something into our bodies, it tends to generate a discussion whether it's safe or not, or, is it going to harm my child or even harm myself as an adult? I'll let you start, Dave, on that one.
Oh man, like that is it's hard, right? And full disclosure, as psychologists, we do not deal with medication, right? Like
Right.
we get some training in it, we have some understanding of it, but we do not prescribe medication. So always my answer is consult with your doctor, right? Or
Yes.
your pharmacist about medication options. But from the research perspective, it shows about 50 to 60% benefit from the medication. So it's viewed as a first line of treatment for ADHD, right? And the way Barkley kind of explains it is that, this is going to benefit a lot of people. So, explore that option, but know that these other non-medication strategies and treatments will help supplement. Even if, the medication is working, it's like being diabetic and having your insulin, but also looking at your diet and looking at exercise and looking at those other factors that are going to influence your ability to maintain your blood sugar. So this would be your ability to have attention and focus and impulse control, right? Those are the kind of the main highlights of the challenges.
Yep. And I always tell, families that I'm not, pushing medication, but we also have to understand sort of the severity sometimes of the symptoms and how it's impacting the individual, whether it's at work or in school or at home. There's a Hallmark study years ago now called the MTA study, the multimodal treatment of attention deficit hyperactivity disorder. And, it's a study that is still being followed up, but it was replicated very well over the years in terms of looking at, is medication helpful or just, behavioral interventions or both. And, the study over and over again has shown that to your point, medication can be helpful so long as the prescribing clinician or physician is well versed in knowing what the different types of medications are, the dosages, how to work with dosages, how to work with different presenting types of ADHD. And there are multiple types of medications out there. And this was oftentimes the results were best for those who were really struggling
Yeah.
in their environments. Behavioral interventions, I think, are very helpful as well. I think the tougher part sometimes for me as a clinician trying to implement behavioral strategies is the consistency or the lack thereof, right? So I can consult with a school and talk about strategies. Half the time, the feedback is that, well, the teacher or the principal said that they would do it, but now they're not,
Yeah.
right? And so the implementation is or the execution is poor.
Absolutely. Yeah, I think, one of the things about medication, and we can highlight some of these myths that are out there, like for a
Yep.
long time, it's just going to make my kid a zombie, or they're going to be hooked on drugs after taking this medication. The research is clear that, it does not lead to substance use. It's not a factor that increases someone's likelihood of using substances as an adult. But think about the challenges like impulse control, right? Like, so hello, you talked about the challenges that younger kids have, but a lot of teenagers, adults with ADHD, substance use is very close, often, coinciding with ADHD, right?
Yeah. So is there perhaps a correlation? Yes, but is it because of the medication? Probably not, right? It's like you said, that impulsivity, like, oh, my friends are all doing it. Why not me? Forget the consequences. I'm not even thinking about those, right? But it looks like it's fun, right? So I'm gonna do it.
Yeah, and the research is pretty clear. It actually, those that were not on medication were more likely to engage in substance use,
Yeah.
right? So, but it is confusing too, because a major, like you said, there's different types of medications. One of the types is a stimulant medication, right? So it's like,
So misleading. Oh my gosh.
yeah. So why would I give my child who's hyperactive a stimulant, right? How does that actually work? And like, this is just craziness, right? But there's logic to it, and there's a lot of research behind it. And I think about this with my son all the time. It's like a certain level of stimulation allows him to focus, right?
Yep. And part of it too, the way I explain it, it's stimulating the brake inside our brains, right? So the brake right now isn't working. Right. So, we're going downhill in a car, the brake's not working. So let's just barrel through everything and see what happens, right? Let's not even think about the consequences. But the stimulant medication is actually stimulating the brake so that you can hit the brake pedal and something's going to work for you to slow down. To think
Yeah.
about, even if it's for an extra second, what are the consequences of my actions here before acting on it? That's how I often explain it to parents.
Yeah, but it is counterintuitive, even like with the fidgets, right? Or the wiggly chairs, or these things that are like, well, that's distracting. That's distracting for the other kids, or that's going to be distracting for that child, but not for the kids with ADHD, right? It actually allows them to focus and attend better when they have a certain level of stimulation. I have this one example that is just stuck in my head. I will never forget this. So my son at one point, it was so hard to get him to eat, right? To sit down at the table and finish a meal was just this like impossible feat, and it would lead to a lot of, challenges and conflict. And so we resorted to using an iPad. And, I never thought I would be, the parent that would be giving my kid an iPad
Oh
at the
no. Yeah.
kitchen table, right? But it was such a neat experiment. Like, he would watch this YouTube, he called it marbles, and these like balls would be bouncing around on the screen, and there would be techno music like blasting out of this thing. And, for other people, that would be like just so overstimulating and like difficult to even, focus on eating something. But for him, his whole nervous system calmed. He could sit there and finish his breakfast in like 15 minutes. And we're like, what is going on here?
Yeah. You know what you just did, Dave? You just validated everybody who uses the screen at me.
Well, again, accommodating the child's
That's
needs,
true.
right?
Yeah.
Like the kids need to eat.
Yeah.
And if it's going to take 2 hours and you're not going to be able to, like some of these kids, they can't even sit on the chair, right? They're hopping off and they're doing other things. And then your relationship with that child too, right? Like, so again, counterintuitive or seems counterproductive, or people are like, oh, that's terrible parenting. And it's like maybe on the surface it looks like that, but understanding what are this child's needs and how can we accommodate them to support them.
And I think you bring up a great point about the judgment, right? The judgment from other people, when it comes to parenting a child with ADHD. I don't know if you want to speak to this because like you said, your son is diagnosed with ADHD, but I can certainly empathize. It's not easy, and there are moments of significant challenge when parenting a child with ADHD. And this might happen in public, right? This might happen in schools, and you get judgment from other parents. I hear it all the time, even anecdotally, not as a clinician, even when I'm just walking through the yard at my children's school, and you hear
Mhm.
stuff of what parents will say about other, parents or children. And so I don't know if it's something you want to share or not?
I'm pretty open about this stuff, and yeah, I still have like vivid memories of walking into the daycare and feeling kind of embarrassed, especially the people that knew that I was a psychologist that worked with kids. It's like an extra layer of like you should be doing better, or you should be, the phrase I hear so much, like especially, from different well-meaning people, but it's like talk to him about this, right? And if you understand the disorder, like you said, talking to the kid, giving them a 20-minute lecture about something often does not change behavior, right? So as much as that is helpful for other kids, so often I'll just say, yeah, I talked to him. Right? Like, because I did,
Yeah.
but I understand that that is actually not going to change his behavior. So, what does he actually need? Those, like you said, we were talking about automatic reinforcements, right? But the same thing with consequences. They need immediate feedback, whether that's positive or negative, to actually help change the behavior. So if this thing happens in the recess and then I talk to him at night about it,
No
good
effect.
luck.
No effect. Yeah.
Good luck
Yeah.
that is going to change the next recess. Yeah.
Yeah. And that's why I like reinforcers too, rather than even consequences or punishments.
Mhm.
Because eventually I tell everybody this, and it often comes true, is that when we provide consequences or punishments, as that child gets older and tries to find their independence and autonomy, good luck, because they will say, what else are you going to take away? What else are
Mhm.
you going to punish me with? Because I can take it, right?
Mhm.
Whereas the reward is it's more merit based, and it's like, okay, you know what, you can earn your screen time. And there's more of, again, that motivating process to say, okay, I'm going to earn it and I'm going to do stuff to get it rather than I'm supposed to do stuff so that you don't take it away. And when you do take it away, watch out because I'm a tornado tearing through the house or tearing through the classroom.
Well, I'm glad you brought that up because, so that's one of the features of ADHD that is not captured with the label, right? So I do want to touch on some of the executive functions themselves, and the one that I'm referring to is emotional self-control or emotional regulation. This tends to be something that lags for these kids. So you combine that, right? You take something away and then they blow up, right? Because they're upset. So here's, there's a couple of these that I really want to make sure that are highlighted because they play such a key role in the challenges that these kids and adults have that don't get captured in the title. So one of the main ones is time blindness, like inability to judge the amount of time that passes while they're doing something. Or so oftentimes it's like, what? I thought I had more time, or like, how is it already time to leave? Or this time blindness that is really not going to change, right? So you need to have external strategies like having a visual timer that kids can actually see visually the time going down. Smartphones and watches and all these things for adults with reminders and cues, because that is just one of the hallmarks of this. And it's not a lack of caring. And so many times, like even with my understanding of this, right, you'll be like, why is that person late again? Or why is that person like, can't they judge how much time it's going to take to do XYZ? Like, and you take it personally. And it's like, maybe they don't care about me or our relationship, but that's not the
No.
case, right? It's,
And
yeah.
that's why when you say like 2 more minutes, 1 more minute, if you just say it, it means nothing. That's why that
Yeah.
visual timer is so important. With the caveat that I know some parents have told me that, okay, I put out the timer, but my child doesn't like it. That's for another discussion. But, for the most part, the visual is much more useful than just a verbal warning.
Yeah, and some kids, ask them what do they not like about it, or try to problem solve around
Yeah.
it. But I know at home, like both my boys we have multiple timers in the house.
Yep.
So when we say there's 15 minutes, they run to the timer and put it on there so
Good for
that they
them.
can actually see how long 15 minutes is going to be. And then when the alarm goes off, they know that the time is up, right? And it's not my voice screaming down the stairs saying like, time's up. So it actually helps, at least in our family. So
Wait, you don't mean
yeah.
you don't mean that they go back and add 2 more minutes to it?
Oh, that has been, so yes, of course. And especially, the kids that are brighter, they're gonna find ways. So I'll start a timer on my watch as I start the timer that they can use to
Yes.
visualize the
There
time.
you go.
So So time blindness, emotional control, working memory.
Yes.
Working memory is one that just like captures a lot of the challenges. So being
Yeah.
able to hold multiple things in your
Yeah.
mind and manipulate them or think about them. So the way this is easily explained to people is just like how many numbers can you hold in your head
Yeah.
at one time, right?
Yeah.
And the average is about seven plus or minus two. Those are kind of the basic kind of idea of it.
Yeah.
But how does this work in everyday life? It's like there are multiple things trying to grab our attention,
Yeah.
right? So we turn on or we look at our smartphone and we have an email and then we
Yeah.
start to go down the email, but then we're like making breakfast and then we're also
Yeah.
doing this. So like a lot of times with kids and adults with ADHD, it's that what's right in front of them is going to grab their attention.
Yeah. And imagine the child sitting in the classroom, right, where the teacher's giving like four steps of instruction.
Yeah,
And, halfway through, the teacher goes, "Oh, wait, nope, go back to step one for a moment. You have to do this first." And then there's like somebody who just dropped a pencil beside you. And so the child sitting there who has poor working memory is going, "Wait, what was that first step?" And by the time the teacher finishes step four, they've already forgotten about steps one and two.
absolutely. I was thinking about this today, just about this podcast, and I'm like, so try this out, right? Any kid with ADHD, you say, start off with saying, we're going to go to the zoo today,
Yeah.
right? And then add three other tasks that they're supposed to do before going to the zoo.
Yeah.
Guess what? That's going to be a fail every single time because as soon as the word zoo comes up, they're picturing different animals and what they want to do
Yeah.
and all of these things, and they are no longer attending to the
Yes.
rest of what you were
The
saying.
zoo's
So
exciting, right?
yeah, so avoid multiple steps,
Yeah.
right? Here's the first thing you need to do when you're done. This is the next thing. Or
Yeah.
like having chore charts, right? Where they can physically move over a little thing that says they've done this thing
Yeah.
and they know the visual aid of helping them know what's next,
Yeah.
the step by
The
step.
visual schedules. Yeah.
Again, for people without ADHD, this seems like a lot of extra work for no reason. And shouldn't they just be able to do that on their own? Well,
No.
no.
Simply no.
And and again, all the rewards and punishments are not going to change that, right?
Right.
So
Yeah.
how do we accommodate? How do we adjust?
Yeah.
One of the things that for parents, it's like if someone needs glasses to see the chalkboard or I guess the whiteboard
Yeah.
nowadays or the smart board nowadays, telling the kid to take off their glasses and try harder and read the board, like it just is not going to work, right? So what are the glasses that these kids need
Yeah.
to be able to function like other kids their age?
Exactly. Exactly. So, I think there's so much more that we could talk about with ADHD. I do think we're going to need probably a part two and maybe a part three to this. Because to be honest, we haven't even touched on more stuff around adult ADHD. And that's
Hmm.
a newer concept relative to children and teens being diagnosed with ADHD. And I think there's a lot of implication to adult functioning as well. So, we're gonna need another episode on this at some point. But what's your takeaway, Dave? I know this is something that we deal with every day, whether it's in the clinic or at home. So, what's your takeaway from today?
My takeaway is probably what I had to learn for myself is like really start to learn the information, right? So if you have questions about this, whether it's medication or whether it's a diagnosis or whether like there's some really good information out there that I think if everyone is grounded in that, then everyone will be treating people better, especially those that struggle with ADHD,
Yeah.
right? Like, yeah.
Yeah, for me, I think it's again, we haven't even touched on some of the accommodations, but I think it's so important for parents, teachers, even ourselves to understand sort of that ADHD profile that we have so that we can implement proper accommodations. So just as an example for myself, I just noticed this actually while I'm talking to you. I don't know if you noticed it. I've been swiveling like back and forth my chair, man. I can't stop. I just noticed that halfway through a conversation. I was like, Dave's not swiveling. I'm swiveling the whole time. But I also realized studying for exams as I was, a young adult, I had to have like quiet music in the background. So if I can impart anything, look, I think the neurodivergent population, the ADHD population, yes, we may do things differently, but it's not necessarily a bad thing. So this idea that, oh, you don't have music in the background while you're studying, like that's going to distract you. For the ADHD brain, that's like you said earlier, right? You're providing a little bit of stimulation so that you can maintain your focus,
Mhm.
right? And so, yeah, it may look different, but it doesn't mean it's not working for that person.
Well, and that's why when it's only 5 to 8 to maybe even 10% of the population, right? The rest of the population is going, well, that's distracting.
Yep.
You shouldn't do your homework with music, or you shouldn't be working on something. You should be focused on what you're doing. And it's like, well, no, once we understand this better,
Yep.
it actually is serving that purpose. So,
Exactly. So gain a greater understanding, ask good questions, ask relevant questions, not good questions, relevant questions. And then like we always say, consult a professional if you or your child need more assistance with this. And yeah, there probably will be a second episode of this.
to be continued for
That's
sure.
right. All right, Dave,
Take care.
take care.